represent a company called INU Ophthalmic Limited. We are a world-class eye center located at Passes Center, Westlands, and we offer all services relating to the eye care. We have services ranging from refractive errors all the way to allergies and surgeries of any kind. We have specialized eye care unit whereby we offer specialized doctors coming in from India who can issue or give you any kind of consultancy which can assist you to understand what is really the matter with your eyes.
We do cataract surgeries that is very invasive, non-invasive, 30% less pain. We do corneal graft, a 10% chances of rejection. We do retina surgeries to people who are diabetic, hypertensive, and most of the time injuries regarding their lenses.
If you have diabetes or anyone in your family is having diabetes, then it is mandatory to do regular eye checkup at least once in a 6 month. Because by diagnosing this diabetes in your eye, we can not only save the vision, but sometimes we can have 100% full vision.
INU Ophthalmic was established in the year 2014 by a group of doctors who were colleagues in university in India with a mission to bring the advanced eye care to Kenya. So they came up with the idea of setting up a clinic, a full-fledged hospital in Kenya to offer the services to the local community. They came with their expertise and their experience, which is unmatched, with close to 80 years combined experience, to come and offer services which cannot be matched in this industry. Their mission was to come to Kenya to bring the expertise to Kenya so that people do not need to travel out of the country for the same. So that was the main focus, because they noticed several people back in the day would travel all the way to India to get the healthcare that is now possible and available here, right here at INU.
So if you have any symptoms regarding retina or diabetic retinopathy, INU has sophisticated equipments like CT scan of the retina, angiography of the eye, by which we can diagnose your diabetic retinopathy and treat in one of the best manner at INU hospital.
Why INU? Compassionate and passionate care. That is what we are proud of. We have an end-to-end service that can be provided for any eye issues or disorders that you may be suffering from.
When it comes to expertise, IND is the best place to be.
We also have an optical shop in-house which offers a wide range of services in terms of all the types of frames, lenses which you might need. We can offer you the delivery within 24 to 48 hours at the most. And we also take insurances against any optical frames if you're covered.
Anything to do with the eyes, you want to see you don't have any problem to do the eyes, we can offer you a solution called LASIK. LASIK most of the time we do to patients who wants to do away with the glasses but their lens are okay. They just want to get rid of the glasses because of high numbers. Very non-invasive, a 15-minute surgery. You walk in the morning at 8:30, 8:45 you're back home. By the next day you can go to your job.
Our surgeries do not need the patients to sleep over or to spend the night in our hospital. That is the kind of facility and equipment that we have in our hospital. We accept all the major insurance companies, including Aetna, Bupa, Jubilee, GA, among others. And we also are fully NHIF accredited in level 4 hospitals, so we can take care of any of your needs that may arise. Our list of happy patients come from all over East Africa, Kenya, Uganda, Tanzania, Rwanda as well. And we are making a mark in each and every patient's heart, which can be seen when you go back to their hometown. At INU Ophthalmic, we believe in giving back to the society. We have a CSR program that runs every single month, whereby we reach out to communities who are not able to afford eye care. We go and screen them, look after them. If they need any surgeries, we bring them to our hospital and we perform for them their surgeries. We have this process also in Nairobi and also in our Nakuru branch, whereby we reach out to the interior, and giving back to the community is an important part here at INU. If you're a corporate looking to have your staff checked, we offer corporate eye clinics here at INU.
INU is a modern eye hospital in Kenya, operating since last 10 years. At INU, we treat cataract patients. It's a daycare surgery, walk-in, walk-out, painless, stitchless, injectionless surgery. We are the only center in Kenya and Nairobi who do their cataract surgery without any injection in almost 99% of cases. And in this part of the world, Kenya and East African country, corneal disease are very common, especially keratoconus, where there is a thinning of cornea and cornea loses its shape. At INU, we are providing the most modern technology to treat the keratoconus patient, like cross-linking, scleral lenses after cross-linking. And in advanced keratoconus patient, we do keratoplasty, that is corneal transplant surgery, which we do a layer corneal transplant also, and few complicated cases where it is required, we do a full thickness corneal transplant.
Sam got an accident while he was playing in school, and it really affected us as a family, because we first of all did not know what happened. I think he fell on a sharp object, which really damaged his eye, the right eye. He has undergone 2 surgeries on that eye, but nothing was improving. So eventually I remembered that I too came to this hospital, INU, sometimes back in 2020, when my vision was really very poor. And as I was treated here, they had a transplant of the lenses, and I'm now able to see very well. I'm able to drive very well at night, even during the day, and my vision is very perfect. I remembered this hospital and I brought Sam here. Unfortunately, the same doctor who carried out that surgery, that operation on me, is the same doctor that actually happened to have carried this other operation. Sam is now very well. His eyesight has improved tremendously. He is able to read even the smallest of the letters. And this is the first month after that operation, and he will come again for review now for the lenses at the lapse of 2 months from today.
My name is Samuel Munene Mugu. I am 6 years old. I had an accident and then I could not see. Now I could not see. Now I have come to the hospital that is called INU. And now I'm happy. I can see. And I'm here to thank God.
So I really must say I am happy, even by what has happened. Now he can be able to smile, he can be able to do, to read and concentrate in school. Isn't that the case, Sam?
Yes.
Yeah, very good.
Nilikuja hapa 2 years back and waliona kama niko na kitu kwa macho, wakasema nirudi ni iwe treated. Zamani nilikuwa nikiwa kwa jua naona mosi. Nilikuwa najikuna chicho. Nikakuja, nikaona daktari, wakaanza kuniatibu. Nilipofika kwa theater, walinitreat vizuri, sikusikia any pain. Walinitreat vizuri. Siwezi kusema kuna kitu ilikuwa mbaya. Kutoka hapa sikukuwa naona, lakini nasa alinishika akanitoa nje, nikaketi. After few minutes nikaanza kuona kidogo kidogo.
I got a big problem with my sight, and then it happened that my cornea had a problem, so I came over here to do the cornea transplant after trying different places. But I'm so happy now, it's over a year. Now my sight is restored. The cornea was restored after they did a partial cornea transplant. I'm so happy for the services that I and you hospital here in Kenya. Of course, I'm from Rwanda, and I used not to drive during the night, but now I can drive. I can read. My sight is much better now, and I'm grateful for all that. Yeah, thank you. I recommend you actually, if you have a problem similar to mine, you can. This is the place.
Nilikuja INDU, nilikuwa na problem ya cornea. Singeweza kuona mbali on my right eye, pia on my left sikuwa naweza kuona pia, lakini ya right ilikuwa imeharibika kabisa. So nikakuja first nikafanyiwa cross linking on my left eye. Alafu ya pili nikakuja nikafanyiwa corneal transplant on my right with Dr. Kaushik, and the process ilikuwa successful, ilikuwa pia affordable. Alafu healing process ilienda smoothly hadi saa hii naona vizuri. Alafu pia nikaenda nyumbani nikaleta mtu mwingine juu aliona hapa kwa INDU naweza saidika, pia kasaidika pia hapa. So leo nimekuja for check up, for review. Alafu nawahimiza hapa you can be assisted, unasaidika.
I had an eye injury way back, and after the injury I visited several hospitals, and they were of the view that the eye had to be removed. But after visiting Mata, procedure was done and corrective surgery done to repair the eye, but the vision did not necessarily improve. And a few years down the road, I came to learn of INDU. After visiting and the first few consultations, they recommended that we do a cornea transplant. The procedure was done in July 2024, and as of today, being the October 2024, I can attest that there is significant improvement in the eye. The vision has improved, and I am to do several, not necessarily several, but one more procedure to insert a lens. And so far, I can say, given my history, INDU has been a revelation.
Assalamu alaikum, dhammaantu waa idin salaamaya. Alxamdulilah, aad bay u fiican tahay soo dhaweynta maxaan ku yidhahdaa safarashika, soo dhaweynta maxaan ku yidhahdaa qaliinka. maasha Allah, tabaarakallah, isha waa la ii qalay. Alxamdulilah, wax kasta waa ka arkaa. Cirbada awal ma gelin jirin, hadda toos u gasho karaa. Alxamdulilah, haa la ii qalay. Tii kalena hadda maantaan la ii abareeshinay haddii la yaaweynkan beri ama beri dambe insha Allah. aad iyo aad baan ugu faraxsanahay. waa soo dhaweynta iyo maxaan ku yidhahdaa checkinka kulli aad nzuri kabisa.
Mama anasema mimi nimefanyiwa surgery, sikuwa naonanga before, na pia saa hii hata sindano sikuwa naweza kuingiza, saa hii naingiza vizuri mpaka bila kukaribisha sindano, na hata kwa mbali. Anasema service zao iko poa, na pia hiyo ingine surgery ingine, hiyo macho ingine pia nataka kufanywa kesho ama kesho kutwa. amesema wanakaribisha, mkaribu vizuri sana.
Today I'm going to tell you one story about my patient. Normally I come from India to see my patient and to do surgeries on my patients from Monday to Saturday, and I leave for India on Sunday. On one Friday, before 2.5 years, one Somali patient came to the clinic. The patient was absolutely blind. One eye was lost, and the other eye, the patient was having a mature cataract. Patient insisted to get operated by me. So we did all the pre-operative precautions. We started antibiotic drops, systemic antibiotics, and we checked the blood sugars and blood pressure. Everything was normal. So patient was taken on a Saturday morning in the operation theater, and we did his cataract surgery without any injection, no stitch surgery. The patient was out in 15 minutes time, and patient started seeing from very next minute. And the patient was so happy. Then we saw that patient for 1.5 months, and then patient went back to Somalia and we lost him in follow-up. After 2 years, same patient turned up, and the patient was having a corneal abscess, that is infection in the cornea of the only seeing eye. Ultimately that abscess perforated, and patient was having a perforated eyeball, and we did an emergency corneal transplant on that patient. And today that patient is sitting in my OPD, and the patient's vision is almost 6/12, that is 80% of normal person of a vision.